I've been told by my nurse if I was thinking of starting a family, I should probably speak to them first. But at the moment, I'm not interested. I've got 2 dogs, they're fine. That's all I need.
Claudia is living very happily with her 2 dogs, alongside her type 1 diabetes. But if you're actively thinking about having a baby, there's important stuff you need to know.
This is for patients who have pre-existing type 1 or, these days, type 2 diabetes. Now, if they plan to become pregnant in the future, the diabetes care has to be absolutely perfect, because what we know is that a lot of the complications of pregnancy with diabetes relate to how good the blood sugar control is in those first formative weeks of pregnancy.
I was quite worried about it, to be honest, at first. Before we started trying for Yolo, I was what we might call not a very good diabetic. I ran high blood sugar levels quite a lot. I'd been diagnosed when I was 4, so I've had diabetes for 30 years. And I'd got into a lot of bad habits, basically, by that point.
In the first 8 weeks of pregnancy, an embryo grows from a bundle of cells into a fetus. All the major building blocks are developing: heart, lungs, nervous system.
And if that baby's been exposed to very high glucose levels at that time, then the risk of complications is much higher.
I can't really remember my HbA1c. We went to see our diabetes consultant, and he explained that it needed to be a lot lower in the run-up to conceiving, not just at the point of conception.
Yeah, it's a bit terrifying. There was the risks of spinal deformities and brain issues. Type 1 diabetics generally have larger babies, so it results in having to be induced early and often C-sections.
We made some quite major changes. I started going and visiting a diabetes specialist nurse almost weekly. For probably about, at least the 6 months up until we conceived, and then certainly for the 9 months after that. I joined a gym, which for anybody who knew me before I had a baby is just the craziest idea now. And that really helped. Regular exercise, that also therefore encouraged me to eat better, eat more healthily, eat regularly.
We made these changes, and actually post having Yolo, these habits and lifestyle changes that we've had have stuck with us, and we continue them on. So going into our second child now, we're much more aware, and we're not making monumental changes in order to, achieve the diabetic control that Claire needed to for the first.
A reminder, please, Claire, of what you had to do for baby number 1.
I had to take extra folic acid. I had to measure my blood sugar levels more often. I had to learn how to count carbs. I had to attend the diabetes clinic much more regularly, and I had to start doing regular exercise.
Excellent. It's about working with your diabetes team to get the best outcome for you and your family.
My colleague in diabetes and I would like to know what your latest HbA1c is, and that'll give a reflection of how your blood glucose control will have been behaving over the last 3 months. If that is okay, then make sure you're on folic acid at 5 milligrams. Don't smoke, little or no alcohol. Make sure you're immune to rubella, German measles, and have a good diet and exercise, and then it'd be okay to start for a baby.
And the doctors need to know what medication you're on.
I'd like to know if you're on blood pressure tablets, and because there are certain ones that are not recommended in pregnancy. Statins for cholesterol are not recommended in pregnancy, so they should stop. There is quite a lot to think about, and so it's planning before you start, not playing catch-up once you are pregnant.
However, nobody's perfect, and if you find that you are pregnant out of the blue,
come and see us immediately. We're not going to shout at you.
If you start a high dose of folic acid straight away and get your blood glucose under control as quickly as possible, you have the best chance of reducing the risks to your baby's health and development. Last word from Claire.
I think in order to start thinking about conceiving, you need to be thinking 6 months down the line. I gave myself 6 months to get my blood sugar levels under control and to keep them at that level for that full 6 months in order to make sure that at the point of conception the baby was going to be formed properly. So now I had a meeting with my diabetes consultant about 2 months ago, and they told me my blood sugar levels are at the perfect level. So my job now is to sustain that for another 4 months, and then perhaps we will start trying for number 2.